we can help you out on that. The state of Texas maintains a database of all vaccines that are given in the state of Texas. So if you were vaccinated here, we probably have a record of it, and you can call up the health department, call up our vaccine department and say, can you help me out so I can know what vaccines I have? It's not uncommon for people to do this. Sometimes we have people that are traveling and they don't have a record of their vaccine shots or their shot records, and we provide them with those records. So when they go overseas, they have those records available to them. The other way that we can tell whether there are any gaps is through antibody testing. And let's go back to measles again, measles, mumps, and rubella. You can do a blood test and we can tell you whether you're immune. Why is that important? That's important because if you had your shots when you were a young kid and hadn't had anything since, your immunity may have waned. And so by checking these levels, you can actually find out whether you are protected against some of these bacteria. It doesn't work for everything. It works for things like hepatitis B, it works for hepatitis A, it works for mumps, measles, and rubella, but for things like pertussis, not so much. So you may face a scenario where you don't have a shot record. It's not something that we can tell whether you have it by a blood test. In that case, you're going to have a discussion and make a decision about whether you want to get vaccinated again or whether you want to just kind of take your chances.